massage therapy?
What is medical massage therapy? Well, that's a very good question to start with, isn't it? In the field of clinical work, the word clinical is commonly used whether you're a clinician in any particular area. And when I created these courses in 2001, I used the word clinical. I thought of the word clinical, and the word orthopedic had already been taken by my former teacher, Benny Vaughn and Whitney Lowe, when they were partners. And I didn't really want to imitate them, so I chose the word medical to imply that we're reaching beyond the standard full body foo-foo relaxation, wellness massage, and into the area of specific treatment. I had just returned from attending 2 Olympics, working with athletes, and I wanted to delineate myself from the area, and those that are going to teach, from the area of standard massage therapy. So the word medical was chosen, and for me and for our students, it implies and states that it indicates that we are following the clinical model. I want to say flat out from the beginning that medical massage therapy is not a technique. It is not a technique. It is a combination of any particular assessment or particular assortment of techniques that the practitioner may have. In my case, I have a strong background with Benny Vaughn in Swedish massage, with Paul St. John in neuromuscular therapy and trigger point therapy, and in many other modalities. So I brought those into the training so that we're not teaching just one particular technique of any kind, and lots of modalities, lots of approaches to get the job done. The word medical massage therapy is an umbrella term. It seeks to cover the scope of the skills that we bring to the session. We're bringing in the clinical model in this application of techniques and in this program to imply that we start with a history. We always get the background from the person of what's been going on. We do some form of assessment, whether it's observation, palpation, assessing and looking at them and having them do the active range of motion movements in the classical physical assessment modality that physical therapists and athletic trainers use prolifically. We always include remedial exercises, we always include hydrotherapy, and we always include a wide variety of techniques, of manual therapy techniques. So that, and then documentation and interacting with other healthcare professionals as a part of the healthcare team, all of that is the clinical model, and that is what we follow. That is exactly what we're presenting. So when you take this course, you're not going to get just techniques. You're going to get the entire clinical package.
And so David, why don't we talk a bit about how the course is structured?
How the course is structured? Well, we structure it classically. I've taught 6 courses for a tune of about 100 hours of advanced training. And what we've done is adapted those programs to the online setup that Sam has been so good to arrange so that we can present those courses online to you. What we've done over the years is filmed all of the classes, and what he's done is placed videos of those classes that I've been teaching over the last 15 years in a website available to you as student. And we compound that by adding in live webinars such as this one. We compound that by adding in a variety of things from the DVDs that we've produced over the years, so that you have a really complete package of clinical presentations and demonstrations of techniques. You get lectures, we get to talk about all the pathologies that I was able to find in my medical doctor friends' medical books, so that we can present those classic diagnoses that you'll see coming into your office. So that's part of the package. We present all of that on a website where you have access to it. It's a self-paced program. You have complete access to that website 24 hours, 24/7. You have the ability to schedule your time, and there are no specific times in which you're able or which you have to show up for a certain time to be in class to have a session with me. It's all there for you to work into your schedule and do it at your pace, and to be a self-starter and complete the program on as timely a schedule as you need. You will have access to the material for 18 months in addition. So it's quite a user-friendly program. And that's what a working massage therapist needs, to be able to work it into your schedule, into your framework, because as you know, massage therapists will be busy during the week and off on the weekends, or maybe they're busy all weekend and slack during the week. So it's ability to you to have a self-paced program.
What people are always curious. Hi, I'm just going to poke my head in.
Hi, Sam.
Hi.
This is us working together.
Yes, we collaborate quite a lot.
And have for many years.
It has been a good partnership, and I so much appreciate it.
Has it been 6 or 7 years total of filming and doing DVDs and him bringing his cameras to my classes on Maui and filming all of that so that we have that on record for you to utilize to your advantage.
I've been thrilled, by the way, with the response that your students and people being introduced to this work for the first time. The response of massage therapists to this work, it really shows how much of a demand there is in the world. In our medical system for this kind of modality. The clinical protocols that you will learn through taking this course with David will allow you to establish yourself as a completely different kind of therapist. The work that's presented here really does differentiate itself from the typical massage therapy session. The close-on modality changes everything for clients that have concerns over body. There's a lot of people that won't they won't allow themselves to get into a situation where they know their physicality is going to be scrutinized. They just won't, they won't book the session because they know that their own embarrassment of their body issues. And the clinical model clothes on allows you to jump over those issues. Men especially are subjected to issues of sexuality, concerns, nervousness towards the therapist. Well, no matter how sweet and wonderful you are as a male massage therapist, you cannot escape other people's internal dialogues over your being a male. Sure. It has nothing to do with you as an individual. It has everything to do with your client's experience. And that's what is the absolute focus of this work, is to give your client the most beneficial experience possible. That has to do with the approach towards the massage session itself, and it has to do with the specifics of what goes on in the session. The clinical modality that with assessments, with respecting protocols, it really creates a completely different experience for a client coming into a session with you as a medical massage therapist.
Very well said. Very well said. And there's a statement on our website which I say flatly and very frankly and very clearly that there are many good technique courses out there. There are some really fine teachers of technique. There is no question about that. And there's a wide variety of techniques available. In this program, you're going to receive and get acquainted with many, many techniques themselves. And in addition, we follow, as I said earlier, the clinical model, which does imply and contain a history, evaluation, a complete focus on what needs to be done, and then homework for the client, be it remedial exercises, be it advice for them to how to sleep, how to place their pillows, how to function getting up, and all kinds of simple biomechanical things that they need to be doing at home. What I have not seen in the workplace or in the teaching system is another class that covers the clinical model as well as we do. So I'm very proud of that, very, very, very proud to be affiliated with a program that has the clinical model. And then, as Sam was very accurately stating, there are many aspects of this particular approach that came about not because it's part of clinical massage therapy, but because it is the way that I do it. So along the years of 38 years of being a therapist, I started out very strong, very fit, and was able to do all manner of work with hammer throwers weighing 300 pounds and shot putters of 250 pounds. And that was the women, and the men were bigger than that. So I have a vast experience in working very physically. Very physically. I was a big and strong guy at 36 years old, and now I'm 74. So along the way, I've had to adapt my practice to continue to achieve the good results that I was always getting, and yet save my body. So some of the features of this particular program that are not necessarily a part of a clinical program. Clinical program implies history, evaluation, thorough treatment, and always remedial work for the client to be doing between sessions. Some of the capabilities of this program are, as Sam said, the close-on approach. I've adapted that from my work and having toasted my thumbs pretty well during neuromuscular work. I'm working on those big athletes for so many years. I toasted my thumbs and therefore brought on the thumb savers, the modified tools that I had from Paul St. John back in 1978. Modified them a bit where they fit my hand better and able to use them as a thumb saver. So saving thumbs, no thumb work included in this entire program. I repeat that, not one thumb technique in this entire program. So you can count on yourself getting continued good results and even better results perhaps than you've been getting with the approaches you've been using. And you will not have to use thumbs. And in the close-on position, it allows you to use the side-lying position to great advantage. People who are just amazed, therapists are just amazed to realize and remember that the body doesn't have two sides, up and down. The body has four sides, doesn't it? So if we find ways to accurately work on all four sides of the body, then we are doing something that not a lot of other massage therapists are doing. Recall that massage therapy schools generally teach up and down. Do the top side, flip them over, and do the other side, and you're done. Well, in my practice, in my clinic, and in my classes, that is not the way we do it. We start off even with the sideline position to emphasize the vast variety of treatments that we can do in that position to achieve things that the client has not achieved before. So what I would say to you, one of the things, many things that I would want to say to you in passing is that I bet you've heard, I know I have heard many times, I'm sure that you have heard, that was a terrific massage. That was one of the best massages I've ever had. And that is quite a nice compliment to receive, isn't it? And I'd be willing to bet that anyone that's listening to this program right now has heard that from one or dozens of clients. Well, after you complete this program and integrate this approach into your practice, this approach of clinical work, this approach of using the combination of modalities and approaches and techniques that we include into this training, you're going to hear things like this. I've had treatment around the world. I've had massage from lots and lots of people, and no one has ever done that. That usually means sideline position, the way we access the muscles, the way we get results by integrating joint mobilization along with trigger point work, along with myofascial work, along with pin and stretch, and a wide variety of approaches that we integrate into the program. And that's exactly what I've been doing for these many years. So you're going to hear that, and you're also going to hear something like this, that 4 visits with you as a massage therapist, as a clinical massage therapist, have helped me more than 4 months of that other therapy that I was doing. And that other therapy could have been a variety of things. Could have been acupuncture, could have been chiropractic adjustments twice a week, could have been a variety of approaches that were taken. It turns out that when you are results-oriented, client-centered, and evidence-based, that your results are going to be really good. So A, we follow the clinical model. B, I follow what has worked for me for 38 years. And thank goodness for the wonderful teachers that I've had along the way. Thank goodness for Benny Vaughn and Paul St. John and Dr. Ted McLean and so many, many others that have affected me and taught me and shown me their way and given me the opportunity to integrate it into my approach and make it mine. And now I'm in the position in the twilight of my career to pass that on to you, to be in the position of passing all that I've gained and all that I've actually conceived. A few things I've actually dreamt up myself, but most of it has come from the inspiration of others. I stand on the shoulders of those that have led the way, have taught us well, all the way from Jack Marr doing sports massage back in the 40s with the Boston Bruins hockey team, and all the way to Janet Travell, and all the way to Ida Rolfe, and Bonnie, I can't think of her last name right now. Anyway, all of the great teachers and all the great therapists along the way have influenced me, and I'm continually reading and expanding and integrating new approaches. So that's what the package is.
And that brings up an interesting question that often comes up, because people, when they're hearing about this work for the first time, they very often ask, is medical massage therapy like this?
Right.
Is it like trigger point work, or is it like Rolfing? And they try and pigeonhole it into a particular modality,
Technique.
a particular technique that is often attached to a particular individual who was a pioneer and figured a few things out,
Right.
and made their own school around their own identity. That's not what this is about.
Exactly. In our field, we are blessed with so many independent thinkers and so many individualists that very often when someone comes up with an approach that they like, or they think they've come up with it, they give it a name. They call it the, I'll use my name, the Morin technique, or the Morin approach, or the Morin method. And I think that's nice sometimes, but frankly, over the years, I have chosen not to do that, even though I could. I have had that opportunity to do that, and yet I prefer to adhere, if you will, to the classic clinical approach and want to integrate into standard therapy. When I treat an athlete, they understand that I'm using the same approach that they've used or they've received in countless athletic trainers' offices, physical therapists, sports medicine specialists. They all use the same approach, not necessarily the same techniques. So which techniques I choose to integrate into my program are the ones that I've been most successful with over the years, and doesn't limit you to being a particular clone of one particular technique. So just the other day, I entertained a question, is this program like something else? And it's not like anything. It incorporates the best of the things that I've seen over the years, from muscle energy technique, joint mobilization, myofascial work, trigger point therapy, neuromuscular therapy, joint mobilization, pin and stretch, osteopathic oscillation, jostling, all manner of approaches that I've used with great success.
And that's that's an important thing, because as a medical massage therapist, your practice is going to change. Work is geared towards client results, getting people with specific issues, getting them out of pain and back in their game.
Right.
And it sets you apart from a traditional medical massage therapist. That is a very necessary role that has emerged in our medical system today. Recently, physical therapists, PTs, have elevated their entire industry. I think it's the only time that it's ever really happened that a professional organization, a professional designation has taken it, the membership of those, of the people who practice that, have taken it upon themselves to elevate their entire field. And it went from having a 2-year postgraduate requirement to requiring a 4-year postgraduate requirement to become a physical therapist. And that changes things. What happens is that it's worth more. It takes more work to achieve that designation. It's a higher level professional designation. And so they charge more. And the insurance companies are feeling the effects of that. Doctors routinely would prescribe physical therapy. Well, now that costs the insurance companies more. And the medical massage therapist is in the position to take up the slack. The insurance companies are looking for alternatives to physical therapists because they charge more. And with a physical therapist, when someone goes to a physical therapist, they are a patient and they pay patient rates. Still, when someone goes to a medical massage therapist, they are a client. and they pay client rates. And there is a difference between the two. You're, as a medical massage therapist, you are not in the business of diagnosing anything. You're able to do the assessment work and to do, work the certain protocols, but you're not there to diagnose. You're there to receive information from a doctor just the way that a physical therapist would, and work a treatment modality around what the physician has recommended, has prescribed. And the depth of knowledge and framework, the entire coursework that David has put together is dedicated towards making you the professional who can participate in that environment appropriately, with confidence, and for you to do real quality work in getting your clients the results that they're seeking.
And our scope of practice covers all of that. Our scope of practice as massage therapists does not mean that we have to be a massage practitioner only, whereby a client comes in and we say, lay down, Mrs. Jones, I'll go wash my hands and I'll be ready to start the session. And just do our up and down massage, our posterior and anterior work, and get them up and let them go. There is no reservation, there is no restriction on us doing the clinical model and adhering to and utilizing that clinical model to our greatest advantage, which is to achieve the results that our client is looking for. That is our goal, after all, to achieve the results. So if you are results oriented, if you enjoy giving a full body massage in a quiet setting with Paco Bell Canon or some other relaxation music playing and not a word is spoken, then that's wonderful work for you. I did that for a while and I didn't find it intellectually stimulating enough, frankly. I find that I love to get my mind, my creative intelligence involved, and finding out other things that can be done that I never dreamed that I could be doing in terms of helping people with all manner of problems that, frankly, in some cases, no one else had helped them with. So if that appeals to you, then this may well be the program that you would like to add to your bag of tricks, to your bag of tools, to incorporate this approach into your practice and make your practice more of a clinical practice. And that is exactly what we're talking about. We want to reach those people who are in or want to be in clinical practice of massage therapy.
You may see on the right side of your screen here a poll. We had one question that I put up, how long you've been working in massage, and now we're asking how many hours a week. We're, just polling just to see, get a better handle on your needs, so that we can be of most service to you. I wanted to just take a break here. We're going to play a little video, just 3 minutes. This is excerpts from David's demonstration series. So it's not complete sequences, it's bits and pieces. This will be
samples.
This will be out of the MMT4, which is
lumbar hip and lumbar spine and hip.
Thank you. So just 3 minutes we're going to play, so you get a taste of what the videos on some of the videos. There's lots of different kinds. There's presentations, lectures that David gives on all of these different topics. And then there are specific demonstrations. Some of that we've shot in the studio. Some of that is shot in the classroom. All of it is designed to be able to give you a close-up view, closer really than what you would get in a live class. You can actually see more of the details in these videos. They're very convenient for you. You can back them up and play them over and over again. If you have a sneezing fit in a class and have to turn away for a couple of minutes, well, what was presented to you in those couple of minutes is gone. They're not going to repeat it for you. Here you have the opportunity to replay these videos over and over and over again as a learning tool to really hone your skills so that you can perform with confidence and get the results that will keep your clients coming back and referring other people to you. So let me just play this video for a minute.
And as you're watching, make note of any questions you have and come back and we'll deal with those questions as well. Thanks.
Okay, we paused it there. That is just a part of the work that is presented. You want to follow up on some of what they just saw?
Yes, I have a comment. Did you notice as I was working through the hip there, it made me wonder just how many massages are being given today where the client is receiving almost no contact to that all-important area of the buttocks, the deep six rotators, all around the sacrum, all in through the hips and the upper legs, because it's draped, because it's considered a personal area, and they glide up the leg and just don't get to the hips. They glide down the back and don't get to the hips. It made me wonder just how many massages are being given, even as we're speaking, where those very important areas to a person's locomotion, to a person's back stability, is being ignored. Did you notice how thorough we're able to be? With a client wearing a simple pair of sweatpants, I'm able to get into all around the sacrum, follow the deep six rotators out to the trochanter, get all around the trochanter, get all into the sacroiliac ligaments, into the gluteus medius maximus and minimus thoroughly, like never before. So I want to just mention that to you as one of the advantages, one of the simple and very distinct advantages of the close-on approach. Not only does it minimize, if not eliminate, those gender issues that we too often face about a male therapist working on a female or a female therapist working on a male, it just leads to too many problems, in my experience, with using draping on naked bodies. So much more clinical in the approach to follow a close-on approach, minimizing those kinds of problems and accentuating the results that we can get, how thorough we can truly be in through the lower back and the hips.
We have on the screen now the registration. If you're interested in joining the class that is just getting started, this week was the opening of the class, the material. So we posted several hours of content. We start with David's traditional course, MMT1. Cervical spine. We also start at the beginning with the course on documentation, MMT6, created by Juanita Thompson, who is David's longtime teaching partner. And that is started from the beginning because that content relates to all the other sections of the course as well.
Exactly.
So we have six modules. There are 6 tests for you to take as you move through the work. In the structured environment, it's a 5-month class. So MMT1, MMT6 start out the program for approximately the first month. Then we will have a webinar where we'll take your questions. Hopefully it'll be a little bit better produced than this one, but I'm happy that we got it on the air, and I'm happy that you're joining us. The technology really is remarkable. It really does allow us to bring this content to people in a way that just wasn't available previously.
Yes, here we are sitting on Maui, and we're talking to you around the world, so it's kind of fun.
Yeah, it's pretty good. Then each month you get additional content. So we will release a test for the 1 and the 6 around the end of the first week in July. And immediately we will add the content for MMT2. And it just goes on like that for 5 months. But that doesn't necessitate that you track exactly with the group. There is, a group energy that gets created, and there are questions in the chat that relate to the particular work that's being done by the group at a particular time. But that doesn't fit everybody's life. Some folks really need the opportunities to be able to structure their learning in their own schedule. Right. And we have constructed the program to facilitate that as well. And it's a very important point. You have, by registering and joining this class, an entire year and a half, 18 months access to the website. And you are free 24/7 to go into the website and use the content. You will get a course manual. It's a nice thick book. That is, that you have that at home. We will be shipping that to you when you register. There are DVDs of most of the demonstrations, just like we just watched a few minutes ago. Those will come to you also as a set of DVDs. That in itself is a $500 value. We've been selling those on the website for many years now for $500 just on their own, a set of 5 DVDs, the demonstration techniques for each one of the MMT 1 through 5. You'll get those. You'll get a set of the thumb savers for your own use to learn and to practice. Those are 3 different tools that really make a difference in how you can extend your massage career, even though your thumbs or your arms or shoulders are wearing out. You can still get in there and apply the sustained, appropriate level pressure using these thumb tools.
Well said.
The thumb savers. You'll get a goniometer to be able to measure and take measurements in your input sessions and in your progress reports with your clients. It's part of the SOAP notes. And we have examples of those kinds of notes. The nomenclature, how to participate in the tracking of your clients' treatments and their improvements so that it is documented appropriately for the doctor's assessment, for the insurance companies, to make it easy to fit into that medical clinical environment. We've presented, David and Juanita have put together a package that gives you everything that you need to do that. The coursework supports the medical terminology. There's an anatomy review. We go through protocols. We go through indications and contraindications.
Exactly.
It's a really very thorough program that's been put together for you. You can register now. Registration is still open, and I guess because of the interest that we've seen in this webinar today, there are still people that are interested in joining the class that is just getting started. So we're going to leave registration open for another couple of days, and you'll have an opportunity to register and participate.
One thing that came up here recently, Sam, and I want to share that with everyone, and that is the question that might be on someone's mind. Well, do I have to stop doing what I've been doing? I'm using certain techniques now. Do I have to stop doing that and use only what you're presenting? The answer is, of course, no. You would want to continue doing anything that you are getting great value with, regardless of the modality, regardless of the approach, or regardless of the source of that material. What I find is the very best or very nice way to approach this program is to begin to assimilate all the things that we're presenting by diving headfirst all the way into the program and utilizing all of this work in your practice, and then take everything that you're now doing and put it on hold just for a little bit of time, put it in a nice little box and put it on the shelf, and then at some appropriate time in the future, months, days, weeks, you'll know when to get your stuff down and begin to integrate back into this program what you feel like you want to continue with. Many of you are doing many fine things in your work. I often have people say that you reminded me of things that I learned years ago and I'm not using. So I've been able to get back and dust off things that I already knew, and yet you encouraged me to do so and caused me to increase my skills by reminding me of things that I used to do and would like to do again. Also, you reminded me that what I'm doing now, some of what I'm doing right now, is exactly what you're doing, David, and therefore it makes me feel really competent that I'm doing things that you, with your experience of 38 years, are finding to be very valuable. That's validating to the person who's working diligently along with the techniques that they now have. And then thirdly, people say, yes, in addition to reminding me of things that I had forgotten and letting me know that some of what I'm doing is really right on and just couldn't be any better, you've also brought me some new twists, some new angles, some new approaches, some new tricks, if you can say it that way, from your experience of 38 years in working in the sports arena and with athletes around the world. And what I can tell you is this: when I stood at the Olympic training track in 1996 or in 2000 in Sydney, Australia, and looked around the training track and saw all the other fine sprinters being worked on by their massage therapist, I could easily go from table to table and say, yeah, I'm doing that. I do that. Yeah, I do that. Oh, that looks interesting. I'd like to go meet that person and find out what they're doing. And that's exactly what I did in Atlanta and in Sydney. Went around and met therapists from around the world and asked them what they were doing and show me this and show me that. And we'd work on each other. So for me, it's been a continual program of learning. And as you may have heard before, if you teach, you learn. So in teaching this program, I've learned even more about what I am supposed to know, more about what you want to know, and how to deliver that to you, and how to make it work for you, and how to integrate it into your practice so that you can call it yours, as I am able to call this work now my work.
We have a poll up. It's asking, are you earning enough from your massage practice to sustain yourself? Again, one of the several questions that we're asking to get a better handle on what your needs are, and you should be able to see the results of those, I think, on the screen once the poll is complete. It's still, barely or no is the answer so far. that people are not earning enough as a massage therapist to sustain themselves. And again, that's why this course exists, is so that you can differentiate yourself from a typical massage therapist. This is not about delivering a relaxing massage with, you know, Enya music or in the background. You can have Enya music. There's nothing wrong with that.
I don't know about your experience in massage therapy, but what my experience is that in tough times, when folks do not have a lot of discretionary income to book that massage that they consider a luxury. Yeah, I'm feeling so good. I got this thing happen, so I think I'll just book a massage. Oh boy, what a luxury for myself. What I have found in 38 years is that when times are tough and people don't have the discretionary income to call and book that massage treatment, they will come in if they've been rear-ended and can't turn their head very well to drive their car or to do their work or to get to their job. They will make the appointment and come in and get the treatment that they know they need to continue their recovery from that incident, from that accident, from that condition that they're experiencing. So in tough times, it is, in my opinion and experience, better to be a clinically based therapist, meaning that you're accentuating what you're comfortable treating. And by the way, I'll just share an aside with you that I've noticed in the massage therapy field, and I just share it with you for whatever you would like to make of this. In going around the country as I have for the last 38 years in practice and 20 years or so in teaching, I meet many massage therapists. And so often I get a card and I turn the card over and it has a list of techniques on the back. It'll say Swedish, sports, Reiki, cranial, sacral, this or that. Have a whole bunch of list of things, of techniques that a person has gone out and paid good money to learn how to practice. And you know what? It turns out, in my experience again, that folks generally do not know what to make of those techniques. They don't know what this or that means. Pin and stretch, what does that mean? What does a variety of techniques that we would perhaps learn, what would that mean? I have found it so much more relevant to say on the back of my card or your card, specializing in the treatment of musculoskeletal injuries to include whiplash, jaw pain, low back pain, numbing and tingling in the fingers and hands, hip pain, pain radiating down the back of the leg, ankle problems, and indicate the kinds of things that you're comfortable treating. Golfer's elbow, tennis elbow, jumper's knee, all kinds of things that you would list as literally a shopping list of people to go through and say, you know what, I've got that condition, and my sister has the other one, and my mother has this, and my wife is experiencing that one. So we might just send the whole family to this therapist who's practicing things that can treat accurately and get us results with things that we didn't know where to turn to get. I know 10 massage therapists, but I don't know anybody that is able to treat the kind of problems that I or my family has. So that's just an aside about the approach that I feel is more appropriate than us, let's say, impressing our peers by listing a variety of all the techniques that we've learned over the years and putting those all on our back of our business card. In my experience, very much better to put a list of things that you're prepared and treating consistently and regularly in your office to become known as the clinical specialist, the one to call when you have a problem. That's what I've been able to do in my practice, and that's what I want to share, and that's what I am sharing with you in your practice.
And that's important. You know, you see the numbers, I think, hopefully on the screen there, that only 13% of you are saying that you're actually earning enough from your massage work to sustain yourself. David's comments are all about that, because you will enhance your practice by treating specific problems that your clients have. You're not out there saying that I am a Rolfer. You're not out there saying that I have this technique. You're out there saying, you got a problem. We're here to help you with whatever that problem is in a professional way.
With a variety of techniques. with a variety of techniques, not being a clone of any one particular approach, though it may be good. Many of those approaches, those single approaches, are quite excellent. And you have 9 or 10 of them together lined up in a whole program, you've got quite a package.
And it even goes, towards your interest level. You wouldn't be here checking this out if you didn't have perhaps a little bit more going on for you than some people. Some people approach massage very intuitively. They're not really well schooled. They're not very well considered technically in what it is that they do. It's a hands-on, kind of a woo-woo kind of thing. And there's a role for that. That's what works for some people. It's all they need, just that relaxing thing. But, again, as David said, when times are tough financially, that's a luxury. And those massage sessions, they don't get booked when people have financial pressures. Where you will find consistent work is in the clinical modality, because people have problems and you have the ability to set yourself up to solve those problems. And it's a lot more interesting. There's a lot more that goes into this work in the clinical modality. So if you have that mindset, you understand the protocols, you can understand the physical pathologies and the physiology, the anatomy. If you have an affinity, then you have the ability to absorb this work and transform your massage practice.
Thank you, Sam. And don't think for 1 minute that you have to leave your intuition aside. I have met therapists, and you may be one of them, that says, I put my hands on the body and my hands are led to where to go. My hands get led on where they need to go. And don't think for 1 moment that you need to let go of your intuition, and don't think for 1 moment that we don't use intuition in this program. I love the quote by Dr. John Harvey Kellogg. Kellogg's of Battle Creek, by the way, back at the turn of the century. He said, the practice of medicine, and I suggest the practice of massage therapy, is 1/3 science and 2/3 art. So the science aspect we're speaking of here is know the body. Know the muscles, know where they go, know where they attach, know the tendons, know the ligaments, know the bursa, know the body that you're working on. That's the science part of it. Know the contraindications, know when not to do what you know how to do so well, when not to do it. That's the sign of a clinician as well. So we follow that approach, and then our tuition comes in strong, because we've got a sense of 10 different modalities at our disposal. Which order do we use them in? How do we place them? How do we integrate them? Do we do a little bit of muscle energy, then some myofascial work, followed by some joint mobilization? Our intuition can guide us, along with our extremely good palpatory skills, can guide us into what to do as we know the body and as we know the contraindications. So it is a combination of the intellect and the intuition.
The financial aspects also relate to our tuition. You can go to click that registration link, and it will take you to a page that gives you a tremendous amount of detail about what is included in this course, what's expected of you, what's available to you, and how you can register. We do have several payment plans that are available to you. We have several tiers of work that you can participate in. There's a 5-month online master class that stands alone. With that, you get a 72 CE hour NCB TMB approved continuing education a certificate of completion.
Of achievement.
A certificate of achievement, thank you. And that is a very nice certificate suitable for framing for your wall. That program is available either as a single payment if you're able to, but we also have additional payment plans worked out for you to make it a little bit easier on your budget if that's restricted. There's a 6-month plan, and there's also a 12-month plan that allows you to stretch that out over time.
In addition, we want you to know, you better continue with that. I lost my thought.
Oh, it's okay, because I did want to continue. There's also a 4-day live techniques intensive that David travels still to deliver. And those who have completed the 5-month course are eligible then to take the 4-day live intensive. We really don't, it's not available on its own. You can't just sign up and take the 4-day class. Sorry, some folks want to do that. It's really not how this is intended. This is a very intensive demonstration of the techniques, and then you start trading practice with other people in the room. David will travel around the room. If there's enough people, there'll be a teaching assistant as well. And you will get direct input on your techniques. And if remediation is required, they will instruct you on how to perfect what it is that you're practicing so that you can really get the hands-on experience. And we can give that extra evaluation to give you an additional 28 CE hours approved by the NCBTMB, and another second very nice certificate to go on your wall as well. Those are our certifications in medical massage therapy. Taking these classes, you do earn these 2 professional certificates.
So we're grateful for your interest in this. We're eager to interact with anyone that is eager to move from that place of delivering massage and waiting for that next appointment to call to come in and get that nice full body treatment. We encourage you to give every thought, and we think you are already, in the sense that you're watching this DVD and this webinar about a clinical approach, to integrate this approach into your practice. I have found over the years in teaching thousands of students that what they have learned and what they've gained and what they've integrated is just marvelous, is what they've been able to achieve. I hear stories, I get comments, I get emails from people who've taken the program with me even 15 years ago and saying things like it made their practice and it's meant that they're comfortable with anything that comes in the door. That's quite a statement to make, I believe, for someone who has taken this training and integrated it into a practice, and to be able to say that I am now comfortable with anything that walks in the door. Meaning that doesn't mean that I can cure everything that walks in the door. It means that I'm comfortable facing it, to know that I can either do what I know how to do, or if there are contraindications, to not do what I know how to do and refer to a physician for diagnostic treatment for their benefit, their aspect, and their input as well. So that's been a tremendous experience for me to have been teaching this program now for 15 years and to get those kinds of results. So if you are results oriented and would like to hear people saying things like that about your practice, rather than becoming a once a week customer for the rest of their life, rather come in for 4 or 5 sessions and go about and tell everybody what you did for them.
I'm going to end the poll. You know, we asked you, is your practice holding your interest, or are you bored? And wow, whopping 78% of you have indicated that you need greater challenges to keep you engaged. And I'm not surprised.
I'm not either.
You know, that's what the heart of this work is to be able to ignite you as a professional, to be that therapist, to be that specialist, to set yourself apart from the rest of the pack. It improves your self-esteem, it improves your stature in your community, it improves your financial security. It is just so much to recommend it.
I agree wholeheartedly, Sam. And I'm really thrilled to be here doing this. I couldn't tell you what could please me more than giving back to this profession that I love, that has given me so much. I've raised a child, I've had all kinds of success in my career, and all kinds of wonderful things happening, and it's still happening. I'm still traveling and teaching. I'll be heading to other countries, and I'll be presenting in a variety of very interesting situations that I'll be telling you about in the future. But I'm certainly thrilled to be doing what I'm doing after 38 years of practice, 74 years old, to be in there every day. And I had a wonderful thing happen here in a seminar here a while back, a 75-year-old therapist saying that, David, with your training, I believe I can last another 10 years. Now, that's the kind of statement that I will be hearing and have been hearing from people that with this training, with this approach of saving my body, of working smarter, not harder. We're not going to be showing you how to lift up 300-pound people's legs and moving them all around and doing sumo wrestling with them. Not at all. I'm not capable of doing that
Anymore.
I'm not capable of doing that anymore. I'm not capable of putting in a whole lot of pressure to those people who are saying, yeah, you can't hurt me. Just go as deep as you can, and I'll just lay there and scream and bang the table with my leg, and I'll just receive all of that. That's not my forte. My forte are the people that have been to the Mayo Clinic or three other doctors, had diagnosis, X-ray, MRI, chiropractic treatments, acupuncture treatments, and 3 other massage therapists. That's the client I love to see walking in the door, because number one, I have the benefit of diagnostic procedures such as X-ray and MRI. No, the X-ray was negative. They couldn't find a thing on the MRI, and yet I've got this terrible pain in my arm, shoulder. And I saw a chiropractor, I did this, did that, tried this technique, tried that technique, and now I'm here with you. Well, I've had that happen 1,000 times and more. And what happens, generally speaking, is that they get what they're looking for, because they're really looking for a complete approach, not an ego-driven technique that, oh yes, give me 10 minutes and I'll fix you and you'll be good for the rest of your life. That isn't my approach. My approach is to get in there, roll up my sleeves, and do what needs to be done on a consistent basis to give that person, that whiplash victim, and who hasn't had a whiplash after all? And who knows how to work on the neck really after all? Have you had a massage lately where they really knew how to get into your neck? I doubt it. I frankly doubt it. If you have, then consider yourself lucky, because students that I talk to coming to my classes say, you know what? I haven't had a really good neck massage and I can't remember when. Just for instance, the neck is such a vital area. As we started out this webinar talking about the hips and the lower back and the gluteal muscles and the sacrotuberous ligament and the hips and the deep rotators and so forth, working through that area through clothing. Well, we don't have to work through clothing on the neck. We can be right on the neck and get treatments in there that have not been done before to reach areas that folks have wanted to reach perhaps, but did not know how.
And knowing, you alluded to it before, knowing what doesn't work is also very, very important, because then you are in the confidence position to be able to say to somebody, I understand your problem, and I can tell you now that there is very little chance that massage therapy, for what you're experiencing, there's very little chance that we're going to be able to do something for you. And that is a very, very important thing. It's a true professional who understands the limits of the work that they're offering and doesn't lead everybody down some rosy garden path that, oh, we're going to do 1,000,000 sessions and we'll see what happens. That's not what this is about. You will be creating a structured treatment plan, and you'll be able to have the tools to measure your client's progress through that plan. And if after 4 or 6 sessions something is not working, you know to stop and reconsider. Look at it differently. This didn't work. What else do we have in our bag of tricks that may work? It's not just this vague, open-ended thing. You are trying to find the best results for your client.
Absolutely. Absolutely.
This is the coursework. There's a question here. Is this for licensed massage therapists?
Thank you, Sam, for saying that, because I did want to address that earlier. That's when I lost my train of thought earlier. I did want to say that this program is made and designed specifically for licensed massage therapists. And in states where there is no licensing, we ask all of our students to send in a copy of your license. And if you're in a state where there is no licensing, then we ask you to send in a copy of your diploma from a massage therapy school. We have not accepted nurses into this training, because though nurses know often quite a bit about massage, having given back rubs to their clients, their patients at night, etc., for over the years, we have not felt it as complete an experience as we'd like to have. So we are offering this program to licensed massage therapists, and we ask you to prove that by sending us a copy of your license or a copy of your diploma from massage therapy school. So this program has been designed specifically and is for massage therapists.
And as such, the question here as well about insurance. No, you do not have to upgrade or get special insurance to be able to expand your practice into this clinical modality. Your clients are still clients. As far as the business end is concerned, you are still a massage therapist.
Clearly.
You are putting yourself in a clinical environment and using clinical protocols, but the actual massage therapy that you're doing is no more or less invasive than what other massage therapists do. And you are seen by the industry, by the insurance companies, by the regulators as a massage therapist. Your clients will know the difference. Your relationships with physicians, they will know the difference. It's about all the additional work and all the additional care and professionalism that you bring to your massage practice. That's what they will see the difference. But you are still considered a massage therapist, and it's working within all of the state variations. Every state's got different regulations in terms of licensing and what kind of continuing education hours are required and what they will accept. It's a broad spectrum. We're not able to track. I wish I could just give you a simple updated list, but the states are able to change their specifications within 2 months' time. So it's really just impossible for us to keep track of all of that. We encourage you, we need you to know what your requirements are in your state. We are approved, David's coursework is approved with the NCB-TMB for continuing education hours. We have both online hours and live hours, 72 hours continuing education hours for the 5-month online class and 28 CE live hours for the 4-day optional class, the techniques intensive. And each state has, its own rules on what they will accept for online, what they require you to have for live, and so forth. So you need to check that out for yourself.
And we require you to finish the online program, the 72 CE hours, prior to attending the 4 days, so that we know that you've achieved a good working knowledge of the material that's been presented in the presentations and demonstrations, and a working knowledge of the techniques that you're using in your practice. So that when you get together with me in a city of your choosing around the country, well, our choosing around the country, when we can get together and practice those techniques, you will have already achieved the online program and have that behind you. So that's a very important aspect as well. By the way, speaking of insurance, that's a good question about insurance. I have maintained over the years, and still do, a standard professional liability policy, which you may have. They're available through our associations or through the American Massage Council, and you can acquire those at your discretion. I think it's a great idea to have it in place, and yet there is not, as Sam said, a special insurance or some kind of a unusual designation that we have to achieve. You may have heard, by the way, about medical massage therapy, that is what's practiced in hospitals, or that is massage that's worked in doctor's offices, or only for the purposes of prescription, only by prescription, and only for the purposes of insurance billing. You may have heard those things, and I say that can be true. It doesn't have to be true. It doesn't matter where you are or where I am. If I'm on the Olympic training track, if I'm at the local swimming pool, if I'm at the beach here on Maui doing medical massage therapy, it doesn't matter. What matters is what I bring to the session, the approach that I bring to the session, the sense of completeness, the sense of results oriented, the sense of the clinical model, the sense of using all of the things that we know to be effective, to utilize those in our sessions, and to recommend to our client all of the things that we know to be effective and helpful for their work between sessions. My comment to them is often, you are with you all the time. I'm with you when you come in for a session. If you will do the things that I'm recommending from classic experience, from standard approaches to rehabilitation and remediation of a variety of soft tissue injuries, then you will get faster results. It's just that simple. So often our job is to recruit and be the cheerleader, the consultant to our client, and cheerlead them into more activity because, as you know, if they don't use it, they lose it. And that's true for us. So we emphasize a fitness program for the therapist, and we certainly want to install a remedial fitness program for our clients as they come to us with a variety of injuries and conditions, perhaps that have not had effect or good results from any other approach that they have taken.
We're going to start wrapping things up. I want to address, just wanted to thank Rebecca, one of our new students who has had a chance to receive our course manual and start in this past week in viewing the material. And thank you, Rebecca, for singing the praises of that content. David and Juanita have put together a tremendous amount of content. I know because I had to process it all and turn it into an online course. And it took years for us for them to amass that body of knowledge, to sift through it professionally with their own personal experience, to bring to the top level what works and what doesn't work. And then now that has been packaged in this online course, it gives people an opportunity to be able to access this content without having to travel. You know, David taught in the 8 Western states for many, many years, and only was able to really cover a certain region of the country. This online class is allowing us to reach the world. And it is just really a wonderful use of the technology. And we're very happy to be able to bring this to you.
And it's caused me to be somewhat more interested in world travel. And it very well could happen that I'll be traveling to different parts of the world to present this program or to do these, even the 4-day classes. So who knows what the future can bring. What we do know is that we're here now. We're here to serve you. This is what we do. Sam has been the master of packaging everything that I've done for the last many, many years. And as he said, we've been at it for years. He's been filming DVDs of me working and live courses for a matter of years and integrating that very, very smartly and very wisely and very accurately into a program that you can digest and that you can assimilate into your practice. And we are here to serve you. You will have access to the chat in this program that Juanita and I daily check that chat for your questions. We're looking for questions and comments and statements from students that we can answer and amplify and share with many others. So it's really a dynamic, didactic, interactive program that we are proud to present, and just thrilled and pleased as punch to be in your living room perhaps right now talking to you about it.
And there are, you know, that membership aspect. There are hundreds of people that have gone through this program now. And so there is a interactive chat that's available to you to ask questions, just like Deidre's question here, asking about the fees that one is able to charge as a medical massage therapist, as opposed to a buff and fluff massage therapist. You know, that
buff and fluff.
Buff and fluff. Or fluff and buff.
Fluff and buff.
Well, whichever way. You know, those rates vary widely across the country and by community. So there's no fixed answer to that particular dollar amount of what you charge. But I can tell you from the experience and the feedback that I see from the students taking this course, that they are consistently able to place themselves at the upper end of the spectrum in their community. That's the additional value, that the added value that all of this clinical modality will bring to your work, that you will be able to be on the upper end of whatever is appropriate in your community for your rates as a massage therapist.
Thank you, Sam. They're very good. I see a question here from Kelly. Are you with the American Massage Therapy Association? I don't know what you mean by with. In fact,
Member, I guess.
Well, perhaps. I have been a member of the AMTA for years, many years ago. I'm not presently a member. I was state chapter chairman in New Mexico in 1989. I've known of the AMTA ever since I've been licensed in 1978. So yes, I'm very much with the American Massage Therapy Association. Even though I'm not a current member, I have admired them and worked with their programs for many, many years. So we certainly thank you for listening, everybody. And Sam, is there another question we want to?
Cindy, thank you very much. I enjoy the depth of the content. It's been a wonderful challenge for me as a content producer to be able to transpose the work that Juanita and David have put together into a video package, and as a marketer to find an appropriate way to be able to reach out into the massage community and engage you in this work and offer you an opportunity to improve your circumstances and those of your clients. That's good work that I can feel good about, and I'm happy to do it.
And what I can feel good about as a massage therapist of 38 years, and I tell you flatly that I know my field very well. I know what I know how to do very, very well because I've paid attention. And what has been a great boon to my life has been to work with Sam Small, who knows his work like I know my work. Sam knows the work of video production, of web presentation, as well as I know the work that I do. So he is the master of what he does, and I'm the master of what I do, and I don't pretend to know the technical aspects, and certainly Sam doesn't pretend to be a massage therapist, but we each know just a little bit about what the other one does. And together, we're a pretty good combination, I think you'll say.
Well, I've probably received more massage than most people. Over the course of 25 years, I've had 3 discs removed from my neck with all kinds of muscle spasms and ancillary problems that have resulted from discectomies. And then just a few years ago, again, another disc trimmed. Massage therapy, the kind of trigger point work that David teaches has really saved my life. I would have been crippled, but not for practitioners who knew what they were doing, who took the time to do it right. And so I have a deep and abiding respect for this work.
In that respect, let me ask the public, how many times have you had someone take their hand or some manner of their hand and glide down the side of your neck with a great deal of pressure? And you winced because it's so much pressure along those transverse processes and in the area just under your ear. And you wince and you wonder, why are they using that amount of pressure and digging into my neck like that? Well, that's an indication of what we're talking about. When Sam says he's had 3 discectomies, he means in the neck. And there are areas where we don't want to be pushing that much. And yet there are other areas right nearby that need our attention because there are muscles there. So that's a very good distinction in our whole treatment program, in our whole profession of what can be done versus what is often done.
I'm going to play, as an outro, we'll play another video for you. You can get a sense of what some other folks think of this work from this video, and you'll get a lot of details of what the course is about. If you go to our registration page, you can register for the course that has just started. We'll keep that registration open for just another couple of days. Then if you want to participate, we'll be back again with another round of courses starting in November, early November. So if you join our email list, you'll get information about that. You can find us on Facebook, Health Matters Seminars, Medical Massage Therapy with David Morin. Search any of those words and you will find us. We have videos on YouTube. We have lots of videos on Facebook. And the website itself is therapyedu.net. And so you can find us there, www.therapyedu.net. And parting comments?
Yes, to those people that put on the poll that what was it, they were not happy, or what was that?
78% say that they need greater challenges to keep them engaged.
Oh my gosh. Well, if you want some greater challenges to keep you engaged and also to have more fun than you've ever had as a massage therapist, because it's really fun to get terrific results. It's really fun to have people come in and say, you know what, I've had therapy around the world and no one has ever done that and given me even the inkling of some results that I really desperately need and sincerely want. So if you want to have more fun and get better results, then join up with us and you'll be glad you did. I can certainly refer you to quite a few people who are glad they did. And if you want to join that group, then you're certainly welcome to do so. I look forward to seeing you online. Thanks for your interest today.
And just the questions keep coming in. Thank you. And so we're just going to hang in here as long as they do, because they're good questions. Through going through the coursework, we do have 6 modules. There is a test for each one of those modules. And we do now offer a single certificate for the entire 5-month online master class, 72 CE hours, approved by the NCB TMB. And if you have a particular requirement, some folks need their CE hours documented more quickly than that 5 months. Each of the 5 modules is registered as an independent class. There is an exam for each of the 6 modules. So if you have a particular need that you need a certificate to be able to meet your state's continuing education requirements, please do reach me privately, and we will be able to issue you a certificate for that particular module, so that you can meet your state's requirements.
Good.
So we do have some flexibility of how we issue those certificates, but unless you have a particular need, you will receive a single certificate at the completion of the 5-month class, at the completion of your payment plan of the 5-month class.
Yeah.
So one of the terms of the longer payment plan is that we will hold your certificate back until that payment plan is completed.
Yes. All right. Other question there, Sam? I can't read it, so you do it.
I think, well, a question about the letters, that eternal question of what letters go at the end of your name.
The eternal question of what letters go behind your name. Whatever letters you want to put behind your name is what you can put. If you're licensed in a state, then classically use LMT. When I finished my NMT training with Paul St. John, I put NMT behind my name. Then they came out with a certification. Anyway, it's just up to you. Many students have after they complete their course, have put MMT behind their name, indicating that they're specializing in, to get the public's notice, to get the public's awareness. You can put any number of initials behind your name, and sometimes I've seen initials that I had never seen before, and the person couldn't even determine or tell me what they meant, but they just look good behind their name. So there are no certain requirements that you must state it a certain way or do a certain thing. It's really up to you. I have not put MMT behind my name since it's the course that I kind of designed and didn't feel, I don't know why I didn't put MMT behind my name. I just never have. Just David Morin LMT has been good enough for me. So it's up to you, and you can do it any way you like.
Okay.
Anything else?
I think you're saying the registration page is not up. Send me an email and I'll make sure that you get a link to it. It should still be up. The offer is up here, even register now. That should open you up to our registration page. And forgive me if it is not, then do reach me and we will get you access to to registration. Certainly we want that available for you.
Any other question there that we need to look at?
I think we're good.
Thank you for your attendance. Thank you for your presence. Thank you for all that you do in this wonderful profession that we call home. So if you want to join us in this effort, please do so. I look forward to interacting with you online and even in person as we get acquainted. I've just completed a round of the 4-day classes, gone to Las Vegas and Dallas and Baltimore and Fort Wayne, Indiana, and had some wonderful interactions with people who gave raving reviews over the opportunity to nail it down, to have personal contact with me and have me work on them and have them work on me a bit and work on clients and get the techniques really integrated into their approach and be able to ask questions in person to me. So it's been a remarkable experience and a remarkable way to tie the knots together so that they feel comfortably competent in seeing anything that comes in the door and treating clients and working smarter and not harder.
Very good.